clearly mastectomy is obviously a bigger procedure, but in addition, usually mastectomy is now combined with reconstruction, and some of the potential complications come from the reconstruction part. Not necessarily not blaming the reconstruction, but based on the fact that we insert foreign bodies such as expanders and eventually implants, or sometimes we do autologous tissue reconstruction, which is also a bigger procedure, removing doing DIP flaps, multi-hour procedures with significant recovery options. So clearly infections, bleeding are minimal in general, but when it comes to mastectomy with reconstruction, we see a little bit more flap necrosis, we see potential loss of expander or an implant, we see problems with healing occasionally. And more importantly, we now offer more and more to our mastectomy patients, of course appropriate candidates. We offer also nipple-sparing mastectomy, which is a very cosmetic procedure, but also is fraught with a little bit more complications in terms of nipple necrosis, skin necrosis on the lower part of the breast, depending on the incision you use. Certainly the key is appropriate selection of patients. There are some well-identifiable risk factors for potential complications. For example, for flap necrosis and ischemia, prior radiation is a major issue, smoking is a major issue, vascular disease, let's say diabetes or some of the other comorbidities that potentially increase the risk of the flaps being well vascularized. So appropriate selection is very important, and obviously very good management in terms of prophylactic antibiotics before and after, good surgical techniques, again appropriate selection of incisions and designing how you're going to do the mastectomy. And for example, some patients with some risk factors may be better candidates for skin-sparing mastectomy versus nipple-sparing mastectomy, because if the blood supply is not very good, potentially the flap could not survive. So again, appropriate patient selection and proper surgical technique are the keys.